My name is Alana Lewis Thomas, and this is my presentation on kidney failure. I'm having a little technical difficulties here, so bear with me as I get through this presentation. So, the function of the kidneys is to transport waste products out of the body through the urine. So, anytime you urinate, you are transporting waste products out of your body. It also controls red blood cells and stores and release hormones to maintain your blood pressure. The kidneys also keeps the fluid in the body balanced. And here is a diagram on how that works. So blood wastes in water enters the renal artery and it exits through the renal vein. And then any excess comes out through the urine, through the ureter. So what causes kidney failure? Damage to the kidneys can be done over a long period of time. There are a couple factors that causes kidney failure, diabetes being the most common, and high blood pressure being the second leading cause of kidney failure. A couple less common causes are genetics, issues with UTI tract, and drug and alcohol abuse can also all cause kidney failure. So there are two types of kidney failure. There's acute failure and there's chronic failure. So the acute failure is a fast onset, which symptoms can present itself within 2 to 3 days, and then your patient could be dead. Chronic failure can lead to permanent damage, but it's slow onset. So your patient could be feeling the symptoms over a long period of time before the issue is even detected. As a medical assistant, it's our job to watch the symptoms of both types because the symptoms are a lot different. So here are the symptoms on chronic kidney failure and acute kidney failure. So as you can see, there aren't any symptoms that appear in both, as the acute stage has abdominal pain, back pain, your patient can experience nosebleeds and rashes. All of this, remember, happening in 1 to 3 days. In the chronic stage, the patient can have nausea and vomiting, loss of appetite, trouble sleeping, difficulty breathing, which are all pretty common symptoms of other diseases. So how is kidney failure diagnosed? So kidney failure can be diagnosed through family history. So you go to the doctor and they ask you and you do your checkup sheet and they ask you about your family history. If you have anyone in your family who has a history of kidney disease, this is why. Also, a blood test could be given. The purpose of the blood test is to detect the levels of creatinine in the urine. Also, urine tests can be done, which the urine test tests for proteins in the urine. So if your levels are too high or too low, imaging can be done to the kidney area to see if there's any swelling. A kidney biopsy can be done, and kidney biopsy works. It's a small outpatient procedure where they go in and they take a piece of the kidney and they send it to the lab for pathology. And also, African Americans, Hispanics, Indians, and Asians are at a higher risk of kidney failure than any other race. What is uremia? Uremia is a condition when there's too much waste product in the blood. Uremia happens when the kidneys no longer function properly, meaning there's more waste than the kidney can filter. This usually happens during the final stage of kidney failure when the damage can't be undone. So this is Mostly done in the chronic stage of kidney failure treatment. So there aren't too many treatment options for these patients. They either can do dialysis or they can have transplants. There are two different options for dialysis. As we all know, transplant lists can be 3 to 4 years. So most patients go with the dialysis route. And the two different types of dialysis is hemodialysis, which can be done in an outpatient facility or it can be done in a hospital. And the patient would have to go and get this procedure done 3 days a week. And then there's peritoneal dialysis, which can be done at home with multiple sessions throughout the day. So dialysis is a treatment that uses a machine to do the job of the kidneys and can filter waste out of the body. So as stated in the beginning, the kidney's job is to filter waste. This machine does that for the body. The waste filtered out of the body is mixed with a special fluid to remove waste and clean the blood, and the clean blood is pumped back into the body. So for a small period of time, there's a small amount of blood that is outside of the patient's body. The blood is cleaned and pumped back into the body. And there are your two types of dialysis. So at-home dialysis or the peritoneal dialysis, this option is available to all patients, but it's pretty risky because it's a medical procedure. So the patient would have to take an informational class along with a caregiver that they trust in order to make sure that they're using the system the right way and the chemicals are being used correctly. And here are my sources. So here's a pamphlet that I created that can be given to a kidney failure patient on kidney transplants. As stated before, kidney transplants can take 3 to 5 years. So it's good to give your patient a little background information on how things will work. There's a couple steps here on the procedure of a transplant and who's good for a transplant and when you should talk to your doctor about a transplant. Thank you.